Hello everyone, my name is Dr. Ansuan Matthew. I am a registered pharmacist and today I am here to discuss on one of a condition which has been experienced by most of us. Yes, it is about the drug allergy or the medicine allergy. So what do you mean by this drug allergy? A drug allergy is the abnormal reaction of your immune system to a medication. It can be any form of medication, like it can be the over the counter medications, meaning you can purchase this medication from a pharmacy or a medical store without any prescription. It can be even prescriptional medications or herbal drugs. These are all capable of inducing a drug allergy. The most common signs and symptoms of drug allergy are hives, rashes, or fever. A drug allergy may cause serious reactions, including a life-threatening condition which affects the multiple body systems like anaphylaxis. So why does drug allergies happen? Our immune system helps us to protect from various diseases. It is designed to fight foreign invaders such as viruses, bacteria, parasites, and other dangerous substances. So in case of a drug allergy, our immune system mistakes a drug that enters our body for one of these invaders. The immune system starts to make antibodies, which are the special proteins which are programmed to attack the invader. In this case, they attack the drug. So the immune response leads to increased inflammation, which causes symptoms like rash, fever, or troubled breathing. So let's discuss about the signs and symptoms of drug allergy in more detail. The signs and symptoms of a serious drug allergy often occur within an hour after taking the drug. So the symptoms include skin rashes, hives, itching, fever, swelling, shortness of breath, wheezing, runny nose, itchy and watery eyes. These are the general signs and symptoms associated with drug allergy. And the rare life-threatening reaction to a drug allergy is called as the anaphylaxis, which causes widespread dysfunction of body systems. So the signs and symptoms of anaphylaxis include tightening of the airways and throat, causing trouble in breathing, nausea or abdominal cramps, vomiting or diarrhea, dizziness or lightheadedness, weak or rapid pulse, drop in blood pressure, and loss of consciousness. So these are general signs and symptoms associated with drug allergy. So what are the other conditions resulting from a drug allergy? Usually drug allergy occurs within 1 or 2 hours after you take a drug. But sometimes drug allergic reactions can occur days or weeks after exposure to a drug, and it may even persist for some time after you stop taking the drug. And these conditions include serum sickness, which may cause symptoms like fever, joint pain, rash, swelling, and nausea. The next one is drug-induced anemia, which means drug-induced reduction in the red blood cell count. And it can cause fatigue, irregular heartbeats, shortness of breath, and other symptoms. The next one is drug rash with eosinophilia and systemic symptoms, which is abbreviated as the DRESS syndrome. So it can result in rash, high white blood cell count, general swelling, swollen lymph nodes, and recurrence of dormant hepatitis infection. So these are the other conditions which are associated with drug allergy. So what are the risk factors for getting a drug allergy? While anyone can have a drug allergy, a few factors can increase your risk, and it includes history of any other allergies such as food allergy or hay fever, personal or family history of drug allergy, increased exposure to a drug because of high doses, repetitive use or prolonged use, and certain illness commonly associated with allergic drug reactions such as infection with HIV. So, what are the drugs commonly linked to allergies? Although any drug can cause an allergic reaction, some drugs are commonly associated with allergies, and it includes antibiotics such as penicillin, drugs which are used to treat the pain like aspirin, ibuprofen, naproxen, chemotherapy drugs for treating cancer, and medications for autoimmune diseases such as rheumatoid arthritis. So, how can you prevent drug allergy? If you have a drug allergy, the best prevention is to avoid the drug which has the problem. So, what are the steps that we can take so as to prevent this allergy? It includes first one is avoid the triggering medication. Like once you get to know if you're allergic to a particular medication, then you should not consume it again. Next step is inform your healthcare providers regarding your drug allergy. That is, make sure that all of your healthcare providers, including your pharmacist, are aware of your drug allergy and the symptoms you have experienced so that the drug which has allergy for you won't be prescribed again. Ask about related drugs that you should avoid. You should also ask your healthcare providers regarding the alternatives to the drug that have caused your allergic reaction. And finally, seek immediate medical care if symptoms worsen or multiple symptoms occur together, as in case of anaphylaxis. So, this is a brief information regarding drug allergy and what all steps you can take so as to prevent the drug allergy. That's all. Thank you for listening.